Good evening, everyone, and thanks for tuning in tonight. Thank you to our candidates for being here. Thanks to Hermosa1.com for making this possible. I am Rachel Reeves. I'm a reporter and have been covering Redondo Beach for the Easy Reader, our local paper, which is also a sponsor of tonight's debate. So tonight we will hear from 5 candidates who are competing for 3 seats on the board of the Beach Cities Health District. 3 of them are incumbents. And if you're not familiar with Beach Cities Health District, it is a preventive health agency which serves the communities of Redondo Beach, Hermosa Beach, and Manhattan Beach, and has done so since 1955. A portion of its funding comes from property taxes. So this is a highly anticipated debate and election, just given the situation that we're in the midst of a global pandemic, and also given a proposed project that has the potential to transform the health district's campus on Prospect over there near Burles. So without further ado, I will ask our candidates to introduce themselves for 2 minutes each, and then we'll get into some of your questions. So I'm going to go in alphabetical order here, and Vish, I'll ask to hear from you first.
Thank you, Rachel. Good evening, everyone who's watching. My name is Vish Chatterji. So 12 years ago, I moved here to the South Bay. And when we moved here, my family thought this was paradise. We've got sunshine, we've got ocean, we got happy people, a really diverse community, and wonderful schools. And then a couple of years in, I discovered that my kids at school were learning how to garden. And I thought, well, that's really interesting. What an amazing school district we have. And so I signed up to volunteer to teach gardening. So I became a garden docent about 10 years ago. And in the process, of course, learned how to garden as well. And then a neighbor who I used to walk with gave me a book called The Blue Zones Project, which I read and digested. And I thought, this is amazing. I'm going to change my life around the blue zones. And then I started noticing all these blue zones logos all over town at restaurants and at events. And I thought, what are these logos? What is this blue zones in my town? And then so National Geographic said, hey, this is a blue zones community. And then, of course, I discovered that there was this amazing Beach Cities Health District behind all this. I was in a really busy time in my career. I was an executive in some major corporations, so busy, gunning for the big jobs, really not having time to really be with my children. And even my parents were aging at the time with dementia and Alzheimer's. And I ended up at one point taking a purpose workshop at Beach Cities Health District. And I would say that workshop probably changed the course of my life. I ended up deciding about 4 years ago to exit that crazy executive life and really slow down, to have a much simpler life and really give back to the community. And as part of that, I started a coaching practice where I took my 20 years of business experience, combined with training in yoga and meditation and holistic health, mind-body medicine, and helping executives find more well-being and balance in their lives. I even wrote a book about it. And then in 2017, a spot opened up on the Beach Cities Health District Board. And so I applied for that spot. There were 40 applicants, and I beat out all 40 applicants and was unanimously unanimously appointed to the board. And in 2018, had to go through election where I won. And so I'm hoping that you will consider me supporting me and continuing my work here at Beach Cities Health District. Thank you.
Great. Thank you so much, Vish. Jane Diehl, will hear from you next.
Thank you all for this opportunity. I thank all the individuals who've put all this work together for the forum, and good evening, fellow candidates. I've been a Redondo Beach resident for 42 years. I have 2 children who attended Redondo Beach Unified School District and have become productive and successful adults. As a physical therapist for 42 years, I've helped children and adults to function at their optimum. I was on the Redondo Beach School Board for 10 years and then a year and a half on Redondo Beach Planning Commission. With my election to Beach Cities Health District in 2014, I left the Planning Commission. All of these skills have helped me to be a contributor to the Beach Cities Health District. With my PT knowledge, I presented the idea for a pre-surgery exercise program for joint replacements for our medically certified gym. I opened the door for youth involvement, bringing the idea to the board. With the wonderful staff, the idea has grown to an 85 student advisory board. They will help lead the Youth Wellness Center. My previous board experience helped me to clarify public discussions for our meetings, introduce the idea for meetings for the board to encourage a good working relationship, plus promoting good governance, which I have now completed the special district leadership training. I have been an ambassador for the health district, attending meetings in all 3 cities. One meeting in Manhattan Beach, I connected with the fundraiser for the senior and scout house. I connected her with the CEO, and now the BCHD has provided kitchen equipment, and that will help for the seniors and youth in Manhattan Beach. As we talked about remodeling the campus, I have been concerned that we serve more seniors. My conversations have led to CEOs finding the PACE program. This program could serve 400 seniors with medical services and adult daycare. Thank you.
Thank you so much, Jane. Karen Komitinsky, you're up next.
Thank you to the team at Easy Reader for the invitation for tonight's forum. I'm Karen Komitinsky, and I'm confident that I'm the right candidate for Beach City's Health District. For the past 10 years, I've been a part of the leadership team that charged with the mission of managing public funds, including a general budget and a bond and parcel tax initiatives, while tediously helping to balance and navigate our state budget woes. I understand budget complexities and am willing to ask hard and uncomfortable questions. Given the loss of tax revenue this year as a public entity, it will be very important to continue to prepare and address the coming budget for 2021 and 2022. I have deep experience with facilities master planning and large-scale project design and construction management. However, I also have learned through these experiences that publicly funded projects are only as successful as the amount of hours and effort put into community engagement and communication. I'm a transparent and outward-facing communicator. With the emergency shutdown of schools and the continued community, county, and state paralysis, I've spent thousands of hours on phone calls with everything from state education and public health authorities to the completely petrified parent who's trying to decide if they should move back to Iowa. My silver lining to COVID is that I've learned more about how my community needs me to communicate with them. And finally, I also work in the human resource consulting industry, specifically within the healthcare space. I have over 25 years of helping to build and organize leadership teams through careful, thoughtful, strategic planning. I believe I'm the right candidate for BCHD. My 10 years of public service speaks to my abilities and understanding on how to manage public funds during a time when fiduciary responsibility and communication is paramount. I will work tirelessly in building community relationships and partnerships with other civic leaders across the South Bay because it's the right thing to do for the community. You have my word, and I hope I have your vote. Thank you.
Great, thanks so much, Karen. Martha Koo, we'll hear from you next.
Thank you, Rachel, and thank you, fellow candidates, for joining. I wanted to particularly express my gratitude to all the Beach City's residents who have tuned in to educate themselves on the candidates for the Beach City Health District Board. I really hope that you take the time during the debate to reflect on what your personal health goals are and how you vision a healthy community. And I trust that you'll decide voting for me is the most efficacious way to implement your ideas. I am double board certified in psychiatry and addiction medicine. I have been a long-standing Beach City resident, homeowner, parent, business owner, educated, and innovator. For me, the health of our community is personal and it is a priority. I am a woman of science and a woman of business. I can truly evaluate the efficacy of programs as well as evaluate their cost. I am also an innovator and trend identifier in mental health. It is clear that technology and new technology is going to play a major part in the future of our preventative health care. Now is a pivotal time in mental illness and in substance abuse and in the COVID pandemic. It's also an important time realizing that the elderly is the greatest growing population segment, and we need to do preventative health now to ensure a long-standing vision of a healthy beach community. It's also a very crucial time for the Beach City's Health District Board due to the planning of the Healthy Living Campus. I think that the programs we choose should be founded on the principles that every voice is heard, valued, and considered in project design. I also think that we can only be as healthy as our environment. And so innovation is important, but also weighing environmental impact is equally important. A vote for me is a vote to be heard, a vote to effectively maintain the health of our community and the health of our environment. Thank you.
Great, thank you so much, Dr. Koo. And last but not least, we'll hear from you, Vanessa Poster.
Thank you so much. I'd also like to thank the Easy Reader, Hermosa1.com, and these amazing candidates you've all heard from so far today. We're really lucky in the beach cities that we have such commitment and passion to create a healthy beach community. I am a positive leader, a creative thinker, and a compassionate listener. I am very proud of what the Beach Cities Health District has been able to accomplish under my leadership. We have reduced childhood obesity by 68%. We have become a nationally recognized model for prevention and wellness with cutting-edge programs. And we have pivoted like a ballerina to meet the community needs under COVID-19. I am involved, forward-thinking, and a leader in this community. I've organized my Neighborhood Watch to build connection and safety, and I'm a graduate of the Citizens Police Awareness Academy and the Community Emergency Response Team. I've served on the Redondo Beach Green Task Force to speak for the trees and to encourage a strong environmental policies in Redondo. I'm the founder of the Women's Coalition South Bay, the winner of the League of Women Voters Making Democracy Work Award, and I've been endorsed by the National Women's Political Caucus. I am also endorsed by the Manhattan Beach Huddle. My priorities are to empower teens to continue to speak for themselves and lead us in how to help them, to support the community in creating economic recovery through COVID-19 safety and protocols, and to revitalize the campus in order to protect the community's investment and meet growing health needs. We can make a greener campus. We can generate revenue to support the free programs we provide. We can remedy earthquake problems and chemical issues, and we can respond to the needs of the older adults in our community for a safe, loving, innovative, assisted living. Thank you.
Great. Thank you all for your introductions. So now I will be reading some questions from viewers and readers of the Easy Reader. And if there are questions for all the candidates, then I'll just ask you to put your hand up and I'll call on you. So our first question is from Sheila Lamb, and she asks, how will you propose to raise revenue and reduce costs to address Beach Cities Health District's projected short-term / long-term revenue shortfalls? This is for all the candidates. All right, Martha.
I think there are several things we could consider to reduce costs as well as raise revenue. I think particularly in terms of cost reduction, incorporating new technology into both the admin side of the Beach Cities Health District as well as the health programs offered could be huge. I noticed basic things like the web servers are currently owned and paid for maintenance versus going on the cloud. In terms of technology, I think there are more innovative ways we can reach a lot of the elders with perhaps home sensors and devices like that, which potentially could cut cost. Raising revenue is something that I would certainly need a little bit more time to think about, but because I do think that the programs have been valuable, but I think it's really back to which programs are really bringing in the most revenue for their efficacy. So I think evaluating on a program level what's financially happening is very important.
Thanks so much. Karen.
So just tagging onto that theme, what I would ask for is some accountability and evaluation surrounding some of the benefits and services that are being offered. Specifically honing in on, is there an organized effort to identify and capture costs or the coverage components of some of the services that we're offering to seniors through things like Medicare? If that's not being captured, my concern is that that's a missed window of opportunity relative to potential revenue. Secondly, I think there's a real need to have a careful budget analysis done right now. In the public role that I sit in, I'm very used to sitting in and having opportunities for public workshops with the community, and where the board is not constrained by the Brown Act and can actually have conversations with the community about a budget, an open budget conversation. I think that's really important to do. And the third thing would be long-term solutions would be to look outside of things like Oh, I'm sorry. I'll come back to it later.
Thank you so much. Yep, time's up. All right, I see Jane's hand up.
One of the things that is brought up, and I mentioned earlier, is the PACE program. That is an ability to recapture money from Medicare. We have looked at that previously, and we would not be if we were the facility that accepted Medicare payments, it's a long drawn out process, and that's not an easy one for us. But the whole idea of the PACE program, as I said, that would serve over 400 seniors with medical and a daycare, would be paid by Medicare, would also provide transportation, so that cuts down vehicle trips, and it would have a provider that we're actually looking at right now to find a provider to bring in that cost, and that will probably bring us in at least $1 million or more.
Great. Vish.
Yeah, thank you for your question. As you know, we've had several hours of conversation on these very topics. Thank you for bringing that up before. It really struck me in terms of our operating costs and how we manage costs and how we understand costs. Having led in the corporate sector, there was always an eye towards cost accounting, like how much does a particular program cost? And that's an answer that when I asked, based on your input, Sheila, to the health district executive team, there wasn't a clear answer. I could not identify if there's a particular program in the community, how many hours of employees' time are put towards that program. We've got the direct costs, but what about the indirect employee costs? And so that has resulted in a priority-based budgeting initiative that has now started in place, which I'm very proud of, where we'll be able to actually figure out what, track cost by project. And then from the revenue side, we lease our land, we lease our properties to medical office space, potentially for senior housing. This is how we generate revenue to not burden tax dollars to run the Beach Cities Health District.
Great. Thanks, Vish. And Vanessa, I see your hand up.
I am so proud of the way that our budget at the Beach Cities Health District is transparent and has been award-winning. We've received the Distinguished Budget Presentation Award from the Government Finance Officers Association and other awards as well for our budgeting. And exactly what Vish is talking about, the priority-based budgeting that we've implemented, will help us to see where programs are most effective. And it's not about generating revenue through those programs. Those programs are to be provided free to the community. We don't want to measure our programs whether or not they're making money. We want to measure our programs on how we are improving people's health and wellness. And I'm very proud of the diverse way that we raise revenue in our budget that helps us to weather difficult times. We have limited partnerships, we have property taxes, we have property revenue from the places that we lease, we have investment revenue, and then we have some fee programs like our fitness center, none of which are profit centers. They're all programs that support free programs in the community.
Great. Thank you all for your answers. And Vanessa, I think that's a great segue into one of our next questions. This one is from John Rubiner, and he asks, you say Beach Cities Health District is a nationally recognized model for prevention and wellness. What data do you feel supports this statement?
Sorry.
Vanessa.
since you said I was transitioning, I just figured I'd just keep going. One of the things I think is so great about the programs that we provide is that we do a lot of research before we do them. We let the research show what programs are effective. So we're using programs that have already been proven to be effective. Our school nutrition programs, for instance, are tremendous. The 8-minute exercise, the walking school bus. One of the things I'm most proud of is the Surgeon General visited our community. The Surgeon General of the United States came to our community and said, this is a model program. This should be everywhere. We've been recognized as a Blue Zones community, which is also another rigorous process where we have to meet certain criteria. We are recognized by Modern Healthcare as one of the best places to work. And we are recognized in the Gallup Health Phase Wellbeing Index as one of the healthiest places in the United States to live. And our schools are part of the Alliance for a Healthier Generation, which is a nationally recognized award.
Great. Thanks so much. Jane, I see your hand up.
To tag on what Vanessa said, actually with the Blue Zones, BCHD scored the third highest in the Gallup Share Care Wellbeing Index. And we've been doing these index since we started Blue Zones. So we use measurements. There is no award like an Oscar or such for well-being and health district. So what we do is we evaluate where we stand with our programs. That's how we say that we are renowned or well recognized. With that Blue Zone issue, they have an algorithm that will tell you that the cost savings of the Blue Zone projects in the beach cities is $21 million. That is from their data. That's how they determine that, by decreasing medical costs. And then, as Vanessa said, we've got lots of awards for the best place to work from Outside Magazine, LA Business Journal, American Heart Association, and the American Psychological Association, where we were national award winners in 2018.
Thanks, Jane. Vish, I see your hand.
So Vanessa, Jane, I think the data speaks for itself in terms of national recognition. I think that definitely answers John's question. I have some more anecdotal evidence to add to that. I've had numerous health districts in California reach out to me, CEOs of other health districts reaching out, asking about what we're doing here in the Blue Zones, and if there are things, or what we're doing in terms of the Blue Zones project here in the beach cities, and what they can do to emulate that in their own districts. They're also very impressed with our ability to not rely so heavily on tax dollars and to generate additional revenue streams to fund these programs. So I think that's one piece of evidence. And of course, the National Geographic labeling us the miracle in the Blue Zones, I think, is another really interesting validation from, you know, a data-driven magazine like National Geographic. And then I think we've also seen institutes like Loma Linda, the hospital in Loma Linda, reaching out to us saying, look, we think that the work you've done is helping with preventing dementia and Alzheimer's. Could we do a study in your community to then use that data to nationally influence outcomes in these diseases?
Great. Thanks so much, Karen. I see your hand.
As a current Squirrel Board member, I'm very well aware of the types of programs that BCHD has offered for youth health and youth education, and they're incredible. They're absolutely unprecedented. I think the gap there, though, is of all the things that were just now mentioned that BCHD does for the community or has been awarded on, et cetera, the concern that I bring is that it's not communicated to the rest of the community. I think there's a lot of missing information with my neighbors, frankly. As I've asked around, many of the people that I've been talking to do not know a large portion of the things that were just stated on this, in this Brady Bunch grid, let's call it. So I think it's incredible that what BCH has been able to do. I think it's now time to take that, all of those award-winning things, and communicate that to the public.
Wonderful. And speaking of communicating, I have a question here for Dr. Koo from Gracie Waller. She asks, one of the issues your campaign has focused on is improving community engagement in order to better advise decisions on topics like the Healthy Living Campus. How exactly do you plan on involving the community more?
Excellent question, Gracie. I think that is a huge issue, as Karen just mentioned. I think the Beach Cities Health District does amazing programs and offers a lot. And when I was going around and talking to residents too, it's amazing how many people really don't know what's going on. I think that particularly with the Healthy Living Campus, I think that the board tried to form things like the community working group, but they appointed those people from within. And I think there may have been a better way to Vanessa's shaking her head, so maybe that's misinformation. I think there was a community health group that didn't really seem to adequately represent the community. I think that a lot of the healthcare districts are moving towards a model of 7 board members where they can divide their district into 7 zones and have each board member be accountable for a particular zone in the district. And I looked at these health districts. I don't think that is necessarily a bad idea. It would obviously be a process, but I think a much better way we would meet community engagement.
Great. Our next.
Sure. Can we answer?
Sure.
Or you want to go on? Vanessa's making a face because our community working group worked for 2 years. And that community working group included individuals that are senior that's their job to work with seniors, that sort of thing. It included members from every community. It included members from Torrance neighborhood. It was extremely inclusive as a group. As I said, working over 2 years. I find people don't pay attention to things unless it's important to them at the time. That's one of the reasons why it's difficult to sort of get people connected with the health district. Also, people know blue zones, people know gardening programs, people know all that. They just don't know that the blue zones is the person responsible for those things. So, sort of, if you ask the question a certain way, or our branding has to improve. We've been started to do that at the Adventureplex and other places, but they're closed right now.
Great. Thank you. So this next question is for all of our candidates. This is from Dean Francois. Do you support the Healthy Living Campus Master Plan? And if not, what changes would you make? Vish, I see your hand.
Yeah, so that's probably the most controversial topic of all. And I think that when I joined the board in 2017, this project was already in flow. So I think the first time the idea of a senior housing on the campus was floated was actually in 2011. So it's been 9 years in the making. And I guess when Tom Backley joined as CEO, he said, look, instead of putting all the senior housing on the outside of the campus, let's re-envision the whole thing and make it a much more open plan. So I joined in 2017 as the new board member. And of course I thought, wait, why are we doing this? What are the numbers here? What does this make sense? Is this really something that fits our model? And so those questions ended up going into a deep financial analysis to figure out a plan. And I didn't believe there was enough community input. So where we got to now has community input, has financial backing. So I support it as far as what we've got to. Now the EIR, the Environmental Impact Report, is supposed to give us the real data of, to comprise all the complaints. If somebody complains about construction, well, how much noise is it? How much dust is it? And that's the purpose of what we'll evaluate, the new board would evaluate.
Thanks so much. Jane, go ahead.
Vish, I'm going to continue on Vish's conversation about the EIR. So the EIR is going to have two different things that eventually will require the board to vote. One is what they call the certification. So it will be brought to us. They will evaluate, they will look at pollution, they will look at noise, they will look at all the things that all the neighbors have asked us that they have concerns about. I agree with their concerns, and I don't know the answers until the experts tell me the answers. When they tell us our answers, we can look at the certification. And even after the certification, if we can't find remedies that seem to work, we will also then have to go ahead and vote on the project. This is just still a beginning of the project. There are lots of times that this is going to change. There's lots of opportunity. We're going to go 90 days for when the EIR draft is out there, longer than 45, which is needed by law, because we do include the community. We made all the groups earlier longer so the community could talk to us. So we do it all the time.
Great. Thank you. Does anybody else want to weigh in on that question? Dr. Koo, I see your hand.
Hi, thank you. And I appreciate what both Vish and Jane say very much. And I do, once again, think the board has done a really good and motivated job to try to get the community engaged. I think that the problem is maybe some of what Jane, you said, that sometimes maybe engagement requires people to be paying attention at the right time. I think that COVID really also made it difficult because there was a very important board meeting, is my understanding, in March that got canceled, and I feel like the public didn't feel like that was really rescheduled appropriately with good input. I think that there was a period of time where the board had many months to be looking at plans, but only offered the public 3 days. I think this was last summer, to sort of give some input. And I know there was some frustration there. I think I come in sort of like Vish was in the beginning. I think I do bring a fresh voice, a new perspective. I think a lot has changed in preventative healthcare and medicine over the past, not only 4 years, but 10. And we really need to look at what the current needs are now, particularly with COVID, and how that maybe changes projects and what we can offer the community.
Great. Karen.
Thank you. This whole conversation surrounding the HLC has been a bit of a lightning rod topic, especially for the neighbors in Redondo Beach. And I think that the concern that I have on this and what I've been learning from community members is that there is a lack of consistent and united relevance across the South Bay. And I say that from the standpoint of where the neighborhood in which I sit and coming from Manhattan Beach. So I think what I'd like to see is some open conversations going on within the community to connect BCHD a bit more to all three beach cities. There needs to be a bit more investigation from that standpoint, because it feels like there's a great unbalance across the South Bay, with the heaviest load on Redondo Beach's part, and basically an absence of that in Manhattan and Hermosa. And I do think that's a responsibility of the board members.
Thanks. Vanessa, go ahead.
I think that there's some really important things that we've been looking at that people may or may not be aware of. There are some serious earthquake issues on that campus. There's some serious chemical issues under the ground in that campus from irresponsible dumping by a local dry cleaner. We are pursuing remediation of those things, and part of doing that helps us to see and re-envision that campus in a different way. We can create a park out of a parking lot. That place is covered in asphalt. It does not have to be that way. We can plant native plants. We can have butterfly habitats. We can plant trees. We can do outdoor recreation. We can have Shakespeare in the park, and we can have farmers markets. What we're envisioning is a vital, important program that's going to help fund those free programs that we were talking about earlier in this community.
Thanks so much. I have a question here from Leslie Hagee. Excuse me if I mispronounced that. That aligns very closely with what you were discussing, Karen. So if anybody wants to weigh in, it is Redondo Beach receives a disproportionate burden of in-city services, costs, and negative impacts for the Beach Cities Health District campus. How would you propose to balance this inequity?
I'm sorry, could you say that again?
Redondo Beach receives a disproportionate burden of, I think what she's saying is of costs and impacts related to the proposed development. How would you propose to balance this inequity? Or is there an inequity? Yes, I see your hand, Vish.
Yeah, there is some equity already in place, because there is a Sunrise of Hermosa Beach that is a property located in Hermosa Beach that is assisted living and senior housing that is 80% owned by the Beach Cities Health District. So there's already, that market is already being served. And then in Redondo Beach, on that campus at present, where we had our board meetings in person, just above us, there were 120 residents already living there. In memory care specifically. And so memory care is the higher level of care, people who have incontinence issues, they can't feed themselves. My mother lived there, that's why I know it very well. They can't walk, and they need a very, very high level of care. And that's a very specific type of senior housing that is on Redondo Beach's on the campus at BCHD. And so the proposal is to target that specific type of intensive memory care facility, while Sunrise is another property that is in Hermosa Beach that targets a little less intensive type of care.
Thanks. Jane, go ahead.
I'm going to interpret this question to talk about the impacts of building the healthy living campus as opposed to shared things, because more people in Redondo Beach, because it's closer, use the gym, use the facilities. So yeah, they do, just by closeness. We've been working with that. As I mentioned, we have put in the kitchen into the Scout House. But being on the Planning Commission, I know there are state laws, there are city laws that will make sure that we're good neighbors when we develop. If you go by Legato, which is PCH and PV Drive North, you'll see there are barricades, there are things that are up. There are things that we have to do, and we will be good neighbors as we build the structures. It's mandated by law, but we want to be good neighbors. We will make sure that there is as little impact as possible.
Great. Does anybody else want to weigh in on that particular question before we move on? All right. I have a question that appears multiple times, so won't attribute it to any particular viewer, but this one is for everyone. What actions will you take to assess the cost effectiveness of Beach City's Health District programs and services? Vanessa, I see your hand up.
We've already talked about priority-based budgeting and really looking at the effectiveness of our programs in different ways. It's not about whether or not those programs make money. It's about how they serve the community and whether or not we're serving the community equity, Redondo, Manhattan, and Hermosa Beach. The population of the beach cities is about 120,000, and most of that, more than half of that, is Redondo Beach. Redondo Beach is the largest city in this jurisdiction. And by that way, we get a lot of property tax money from the residents of Redondo Beach, and they are close to our primary campus. But we do have programs throughout the beach cities. We are very, very strong on evidence-based programs, and we like to look at how many people we're serving, what services they're getting, and whether or not those services are effective. And I think that that's the way to make sure that the budget is meeting those needs.
Thank you. Vish, I see your hand.
Yeah, so obviously pushing for priority-based budgeting, true cost accounting, whether direct costs, whether the employee cost for a particular program is the first step. The next step is to then see, when we put a program out there, is it targeting different segments of our population? Is it only for kids? Is it only for seniors and kids? What about the working population? What about the working professional with young kids population? So really making sure that we have a balance across different segments of our community. But the other thing is also using the Gallup surveys and really seeing what are the needs, and are the needs changing? 10 years ago, 5 years ago even, we didn't have a youth substance abuse crisis. We have that crisis now. And so all of a sudden, that becomes a very important program. Now, how do you measure cost effectiveness? We're obviously using evidence and data to see, did this make a difference? For youth obesity issues, did we reduce obesity? LA County Department of Health looks at our data and says, let's audit this data. And they came up and said, these guys did a good job. This is, it adjusts for socioeconomic changes in our district.
Thanks, Vish. Jane, I see your hand.
We work a little differently. We have 40 programs, 25 partners. We have over 1,125 volunteers who donate over 36,000 hours. So when we do a program and when we apply it to something that is more business-like, you could see that model doesn't work as well as a straight business program. The idea of the volunteering, we promote as something that not only helps us, but the studies have shown that people who volunteer have better immune systems, better lives. So we use a lot, and our partners, you can imagine if we start talking about getting rid of programs that our partners have been involved with us, that's going to cause a problem as well. It isn't just we do the work and that's that. We're very much intertwined into, as I said, 25 partners and all of these volunteers. So it's a little different.
Thanks, Jane. Karen, go ahead.
To that end, at the end of the day, you're talking about a publicly funded entity, and that the responsibility of the board members is really to manage those public funds on behalf of the public based upon what the public's interest is. And so I'm actually the candidate who's willing to ask the tough budget questions relating to forecasting and scrutinization of funds and what those revenues look like, to the point of the fact that these programs are offered to encourage, healthy living, et cetera, is absolutely important. That's paramount when you're talking about a public health organization. But there is a cost piece of it to it that has to be mindfully managed when it comes to public funds.
Great. Martha.
And yes, I agree. I mean, I agree with Vanessa and Jane that, what's most important is the health of the community. But as Karen said, there is a cost to providing that, and we need to evaluate it. And I think one thing that I've been trying to look when I look at the finances is the specificity of program cost and tracking that. Not because we're only looking at cost, but we have to evaluate the benefit of a program and even qualitatively what it's doing in the community. I think we do need to know what the cost is, and we can includes volunteer man hours, right? And that includes other admin hours. But unless we track each program, I don't really see how we can absolutely evaluate its cost efficacy based on even, qualitatively what it's doing in the community.
Excellent. So our next question is from Malcolm Williams. Very relevant. He says, there will be a day when the pandemic ends, but COVID-19 will leave behind a number of health issues such as disability, anxiety, and depression, amongst others. What is your vision for how Beach Cities Health District can work on addressing these in the South Bay? So we'll hear from you first, Vanessa.
I am really proud of the way that the health district has responded to the needs of the community around COVID-19. We've done 61,000 tests, and we average about 328 tests a day, helping people in the community keep themselves safe. And we have created a program called Safe in the South Bay, where we have done the thing that the health district does best, which is build a coalition, bring people together, the schools, the city councils, the chambers, parent groups, other community organizations, bringing everyone together to provide understanding of protocols so that people can reopen safely. One of the things that the questioner mentions is dealing with the anxiety of all of this. And we were ready with our mental health and happiness program, where we're talking about how can we help people in the community stay connected, stay healthy and happy, and that is a health need and that is a health measurement, as much as heart disease and diabetes, which we want to deal with, and having programs to help people be connected.
Thank you. I think your hand went up first, Jane.
We talk about how things are going to change with COVID. The district put together multiple virtual programs. They were featured in the mental health, in the kindness section, because of the mental health program that we've done virtually. Those would normally have been done on a face-to-face basis. So we've adopted to the virtual world with our issues for mental health and happiness. But where we really want to bring them is to the outside world and having those opportunities with individuals. And those were programs, as Vanessa said, we had planned, we were ready to go. We have packets of information for all cities. One thing, as Vanessa said, that we work with cities. One thing people don't understand is that we are the glue. We are the people who get the other people together to sit down and talk. And so we have proposed to the city councils these package for happiness, and that will continue when we get to speak with each other again.
Great. Karen, I see your hand.
So while I appreciate all the things that BCHD has done, we're sitting in the middle of a pandemic. And it is a pandemic that if you watched 60 Minutes last night, you'd see that we're not getting out of this anytime soon. It's going to be quite some time. And so one of the things that I think that the Beach City Health District could do, and I'd like to see it if I'm securing a seat, would be to take vaccination education to a whole nother level. We have an interesting thing that's happened. We had a number of years ago where we transformed California state law to change the vaccination process for children getting into elementary schools, to now we've got people chomping at the bit wanting to have a vaccine for COVID so that they could get back to their lives. There's a whole lot of that in between that I think BCHD could do in offering a vaccine education platform that could talk about everything under the infectious disease umbrella, bringing in epidemiologists, et cetera. Because right now, the community wants that information. They're looking for that information.
Great. Dr. Koo.
I also think the Beach Cities Health District did a wonderful job in terms of the COVID testing that they've incorporated and changing many of the programs over to a virtual format. I do think that we've seen some other opportunities that I would still love to see happen quickly. I think that talk about the Healthy Living Campus and the space we have there in the parking lot. You know, a lot of gyms and even daycare centers have been able to open up and offer their services in outdoor spaces. And I think the virtual mode is great, but I think that there could be some effort made to bring those to the outdoors in terms of the space we have, and probably some funds for, I know it would cost for coverage, but I think that we don't know how long this is going to go on. And I think making use of those opportunities under CDC guidelines would be a really good thing to be able to do.
Excellent. Vish, I see your hand up.
So I think in the US, we have a pill problem, and this is known. I mean, we've got opioid addiction issues, we've got all sorts of issues with overprescription of medications. And when we talk about anxiety and depression, the first resort ends up being a psychiatrist might prescribe a pill that comes from Big Pharma. And that's our standard response. And at Beach Cities Health District, where I'm so impressed and where it lines up with my own personal views, is you can do a lot to improve your happiness and deal with mild depression, mild anxiety without using medication, getting community together, getting people connected to each other, moving naturally, gardening, eating better foods, eating less processed foods, having a better daily schedule. And so I believe that in mental health, there's a spectrum. And part of that spectrum requires medication and intervention. But a big part of that spectrum we can handle with just natural means, which Beach Cities Health District has been promoting for years. So I think we're really well positioned for this post-COVID time, if and when it comes.
If and when. All right, we have a question here from Chris Navarro. For everyone, do you think there should be any changes made to the Beach Cities Health District board member criteria regarding qualifications, term limits, and or number of members? So Martha, we'll start with you.
I already did mention when we talked about more community engagement, the possibility of expanding the board, because I do know that it is a trend in other health districts. And if that is something that the public would be interested in doing, it does allow us to have sort of zones in the district and have each board member be particularly responsive and accountable to their zone. I also think that their term limits is a really good idea. I think that as we see, people do bring in fresh voices, new perspectives, new backgrounds, new history, and that having maybe a 2-term limit would offer an opportunity for growth and innovation in a really practical and fair way.
Vish.
Well, I'm the candidate who has like you, Karen and Martha. I've been in the same shoes trying to break into incumbency. I first ran in 2016 against 3 very strong incumbents, and it was really, really hard. It's a tough board to break into because it does such good work and very, very qualified people. In 2017, when I applied for the appointment process, the other 39 candidates were incredible. It was really I was quite overwhelmed and intimidated, actually. I was very excited to get unanimously appointed by the board out of that crowd. And then 2018, when I had to run for election, a Hermosa Beach candidate ran against me. And the complaint was, we're not represented here in Hermosa Beach. And so after I won that election, I made extra effort to spend a lot of time in Hermosa Beach and Manhattan Beach to really understand the issues and the needs in those communities as well. As far as term limits, I've been very public about wanting to push for term limits because I felt like me being the new board member really brought a fresh perspective. And I think that's a good thing every 8 years, 12 years, whatever it ends up being.
Great. Thanks, Vish. Jane, I see your hand.
I'm going to be a little of a historian. So I've been there for 6 years. And during that 6 years, we've had 3 different, we've had a board member pass away, which created another board member to come in, which then she became ill, which created a position for Vish. So the board has not been a place where people are there forever. We've had people coming and going. I'm not against term limits. I just wanted to make it clear to everyone that we have people that have been there. Vish has been there what, 3 years now. I've been there 6. Michelle, I think, has been 8. So, and Noelle longer, and Vanessa longer, as people know. So we do have a board that is different people. They've served different time periods. So if the city wants to look at this idea of districting, I say then that's a good plan.
Great. Karen, you're next.
So I didn't really give any thought to the expansion of 5 to 7 until Martha brought it up here today. And it's kind of an interesting topic. I'm leaving a board after 10 years. I've been honored to serve in the capacity I've been. I've served for 2 terms. I finished a term for Amy Howarth when she left to run for City Council Manhattan Beach, and followed on to 2 subsequent terms. And it's time. It's time for me to go. It's my daughter's now a junior in high school. I'd love to see her finish her senior year, but that's all weird anyway. So it's time. I believe that 10 years I have accomplished a great deal. I have worked with the most amazing human beings, but I've caught the public service bug, and I think it's time to move on to something else. And I'd love to get a shot at trying this.
Great. Vanessa.
I think that elections are a really important form of term limits, and I am very pleased and very honored by the voters of the beach cities, Redondo Beach, Manhattan Beach, and Hermosa Beach, who have chosen in their wisdom as voters and citizens to return me to office at high margins in each election in which I have run. And I believe that my institutional knowledge, my personal passion and commitment to health and wellness, and my particular skills in consensus building and open communication have served me well in serving the people of the beach cities, and I am grateful to them for giving me this opportunity.
Excellent. All right. I have a question here from Mark Nelson about whether you believe that the continued operation of the Beach Cities Health District should be put to a vote. Vanessa, go ahead.
As the resident historian here, there's something that people really need to understand. If there were no health district, then there would, first of all, be none of these amazing programs that we've all talked about, and the people that are on this Brady Bunch panel here all agree have done amazing things in this community. The property tax money that comes to the health district is 25% of our budget. We have been very creative in finding other ways to generate the revenue to provide those programs free of charge to this community. If the health district did not exist, no money is coming back into the pockets of the residents of the beach cities. That money, you would continue to pay that money, which is less than 0.001% of your property taxes, which comes to the health district. It would then be distributed throughout LA County. So what the health district existing does is bring that money back, your money back, to serve your community. And that's wonderful that we can do that.
Great. Vish, you're up next.
I mean, the health district is what helped me understand what a quality community we live in. You know, when I discovered the things that I said in my opening statement, the things that were happening in the schools, the things that were happening around town, the blue zones, it improved the quality of life in the South Bay. Our health district receives so many accolades from our local schools, and our local schools also drive quality of life and property values in our area. I also was able to calculate that on average, specifically in Redondo Beach, is about $20 a person per year. In the Manhattan Beach, or all districts combined, because Manhattan Beach's property values are a lot higher, it ends up being $30 per resident per year for the health district that goes to health district revenue. So if you take 1 or 2 yoga classes a year, you're breaking even. The health district then takes that $30 and multiplies it 4 or 5 times to then give these massive services back to the community. So I wholeheartedly support Beach Cities Health District existing into the future. It improves our overall quality of life, and it doesn't actually cost us that much as an individual.
Thanks, Vish. Jane, you're up.
Some people are talking about the fact that an organization like ours may be the thing what we need in the future. So it would be very short-sighted to get rid of it. How did we rise to the ability to deal with COVID? We rose to the ability to deal with COVID because we have good partners. We partner with all the cities. We partner with all the schools. We partner with the county. All of those things enabled us to come together quickly. We have partners with Children's Hospital because when the kids are going into school, they have an assessment tool that all the schools are going to use. And that's partly because of our reputation, and people know us. They know we're the glue. They know that some people say that if you want to have a healthy community, you go to the policymakers. We've been doing that for many, many years and having meetings, as Karen knows, with Manhattan Beach, of all the city council and the school board and the Beach Cities Health District. We all had a meeting together, and Hermosa as well.
Sorry to cut you off,
Okay.
but Dr. Koo, we'll hear from you next.
I think that it's very clear, obviously, the three of you truly value the Beach City Health District, and I do too as a resident. I think what I would just want to point out is that a question was asked, and from my perspective, I'd want to understand more where the question is coming from. I'd want to understand why that person is thinking that, what would be the alternatives, and I think this is a good example of when the community doesn't feel heard, because I think the three of you answered, which is your opinion in terms of that it should stay. And I think you give very good reasons. But I think what hasn't happened is that questions that have been asked are truly taken and heard. And, we've been curious about them. And I think board members need to have that attitude. Despite what we feel individually, I think we need to listen to the community. And if they ask a question, we need to try to figure out what the question is about and truly answer the question.
Thanks so much. Karen, I see your hand.
And to tag on to that, I think that the question really it goes back to what I said earlier. There's a great amount of responsibility on Redondo Beach's shoulders to carry the heaviest part of this load. I'd like to see actually conversations open up where BCHD, because BCHD is very valuable, but I think it could be valuable in a different way. I think the question needs to be divided up. Are we talking about the bricks and mortar facility, or are we talking about what Beach Cities Health District offers to the community? If it's about the part of what it offers to the community, then let's talk about the possibility of taking BCHD and embedding it in actually each three community. Look at open commercial real estate that's available based upon businesses that have gone belly up. And there's things that are open. And couldn't we actually take BCHD and actually physically plant them in each one of the beach cities, therefore embedding you closer to the community? I think that you could divide staff up and you could put them in each one of those sites. That to me is a way to really answer and really infiltrate public health within the South Bay.
Thanks so much. So unfortunately, we are running low on time. I am going to take one more question. We have so many questions tonight. So I would just encourage all of you whose questions we didn't get to communicate with the candidates on your own time. Christine Sue asks, how can you as a board member increase stakeholder participation in your programs? And that's for everyone. Vish, I see your hand.
So one of the things, as has been mentioned tonight, when I joined the health district, I found that there was a group of people, thousands of people in our community that really know the health district and enjoy the programs, and there was also thousands of people who had no idea that it exists. And so I asked, what is the brand awareness score? What is the brand awareness penetration score? A very standard marketing term. And at the time, I think it was around 35%. And so I said, well, that's not good enough. If we're serving 100% of the community, 100% of the community, or at least something close to that, should know about it. And so they made, the staff took some efforts to try and increase understanding of what BCHD does. They did some more marketing work. They did revamp the website. We started to say, look, let's get our logo to really stand out in the different facilities that we do have scattered throughout the community. There's a clinic for low-income people in North Redondo, and it doesn't really say Beach Cities Health District on it, but it is one of our properties. So I believe in the future, part of it is also getting deeper involved in social media, where there's a lot of misinformation sort of spreading around. I think Beach Cities Health District needs to have more of a presence to really educate the community through some of the more modern communication channels.
Thanks, Vish. Jane, go ahead.
To Vish's point, our communications team has worked very hard on communications. Most of you probably have seen they're using Nextdoor now to put their programs out and promote those as well. The newsletter comes to anyone who asks for it. And I think that is a service that maybe we should make more visible on the website, because I realize that's the easiest way to find out information. And instead of going to the website and searching for things, we have tons of information about the healthy living campuses, about last week was the virtual aging program. We have lots of information on those websites. That is the way it appears that the younger group are going to become more connected with us. The older folks is usually through programming and making them available to them, which I'm hoping the PACE program, once again, will bring more of those people into the center because of their needs.
Great. Thanks, Jane. Karen, go ahead.
Along the idea that I mentioned a minute ago, I think the biggest thing that you have to do is you can't be an entity that is just, sitting in one location. You have to physically get up and reach out to your community. I've been walking the neighborhood around BCHD and all the way down to Torrance Boulevard, and I've heard a lot of conversations from a lot of people that they've not been heard. And so the first thing I'd want to do is I'd want to survey the entire community, BCHD, the whole South Bay, to really find out what is the neighborhood, what's the community want? What does the neighborhood really want? And two, you could even take the idea of mirroring your neighborhood watch concepts that we all have in the South Bay and think about building to somewhat to what Martha was saying earlier, these districts, but host actual board members in each one of those districts and have public conversations. Listen, have coffee clutches, sit down, break bread. It's important, really important.
Vanessa, I see your hand.
I love to hear the things that Karen's saying, and I want to also point out how we are in the community, in Manhattan Beach, in Hermosa Beach, in Redondo Beach, on the ground. We have Adventureplex, one of our biggest facilities outside of the main campus, is in Manhattan Beach and provides great service in that community. And it's a way to bring our stakeholders to us by going to them. And the other way that we've done that that's been amazing is the Yoga on the Beach, which is also, again, in Manhattan Beach, where hundreds of people join together on the beach to do yoga. That's free and beautiful and fun and healthy. And the other thing that we've done that is so remarkable is the Beach Cities Partnership for Youth, where we have brought together, like I've talked about, other people have talked about, everyone from different levels of government, community, schools, to work to help the teens speak for themselves and tell us what they need so that we can provide programs to help them prevent drug abuse, prevent vaping, and prevent bullying.
Thanks, Vanessa. Martha, I see your hand.
I agree with Karen that a lot of grassroots outreach was really, really valuable. I also think of basic getting into the community by, we say, involving them more. When my kids were little and they would take a field trip to the Roundhouse, then we all became aware of the Roundhouse. So I think there could be more inclusiveness, like from elementary school to have field trips and see what all the, field trips to the Adventureplex, field trips to the Beach Cities Health District. When they go, their parents are aware. I also think that in high school, a lot of high schools are offering classes as internships, where our world is becoming a much more experiential learning world. I think as a class, there could be an internship to work, in any of the programs. And I think that that would be a way to really bring the community also more into the Beach Cities Health District and more awareness of the programs.
Excellent. So on that note, we're just going to have to wrap things up here. I'm going to ask each candidate to deliver his or her closing statement. So you'll have 1 minute each, and we'll go in the same order that we did for introductions. So Vish Chatterji, we'll hear from you first.
So Beach Cities Health District running a $15 million a year budget and a sizable multi-$100 million project being considered it's important to have somebody on the board that has formal training in finance. Having a master's in business administration, having run organizations and being trained in organizational management for the last 20 years, I think that's a really important skill to have. And having an undergraduate education in mechanical engineering also doesn't hurt in evaluating construction and plans and drawings and architectural input. When we get down to the EIR and trying to evaluate the data of what this project might entail, understanding that it does help to have an engineering mind and a business mind around that. And of course, my complementary medicine background, really using the tools of yoga, using mind-body medicine, using meditation, mindfulness techniques, ways for community to connect in a deeper way so we can have a more natural, happy existence in the South Bay. And so I've always pushed that part of my role here is to ensure that we have a happier and healthier South Bay.
Thanks so much, Vish. Jane Diehl, you are up next.
Hey, if I'm fortunate to continue to serve as the residents of the beach cities, my background will continue to help move the health district forward during these challenging times. My goal is to maintain fiscal stability while we maintain the quality of our programs. If we move forward with the Healthy Living Campus, I have the background to make sure the assisted living facility has what is needed for safety and maximum functioning. These skills will also help with the development of the PACE program. I understand building with my experience in remodeling Redondo Union High School and being on the Planning Commission. I retired this year, so I will have more time to be an ambassador. I want to serve and connect with the citizens. Continuity and knowledge will help the health district be sustainable and innovative. Please vote for me so that the health district can keep our programs that help keep the beach cities healthy in these challenging times. And I want to say thank you, Rachel, for doing such a great job.
Thank you so much. We will hear from Karen Komitinsky next.
Thank you again to the Easy Reader and for all the viewers out there tonight. Thank you to the other candidates in the engaging conversation also. I hope that I've shared with you not only my experience, but the passion that I have for this kind of work. According to Webster's dictionary, public service is defined as, quote, providing service rendered in the public interest. If I've learned anything over these 10 years that I've served, I've learned that one must be willing to be comfortable in uncomfortable settings and to build relationships steeped in trust and open communication for the community in which one serves. I firmly believe this is vital to be outward. It's vital to be outward facing and welcoming within and across your community. I've done this work for the past 10 years and committed to continuing and broadening that across the South Bay. You can vote for me at Komitinsky for bchd.com. Thanks.
Excellent. Thank you, Karen. So Martha Koo, we'll hear from you next.
Thank you, Rachel, very much. And thank you, Easy Reader, New View, Peninsula, and Hermosa One for this platform. And thank you to all the Beach Cities residents who listened. I'm an ideal candidate for the Beach City Health District Board. I've been a resident for 28 years, a successful business owner for 22 years. I raised my children here. I'm an expert in medical issues, mental health, and addiction. The Beach Cities Health District is an amazing public health agency, and I feel the community and the board deserve someone who is a mental health expert and advocate who brings experience in science, business, and innovative technology. I believe the Beach Cities Health District can improve its community engagement and improve the financial and efficacy evaluations of programs, and I also believe that we can invite more innovative technology. I value transparency, I value protecting the environment, and I value offering a fresh voice and new perspective. Please email any questions that you have. Please check my website. I'm going to be offering weekly Zoom meet and greets for more information. I humbly ask for your vote for Dr. Koo on November 3rd. Thank you.
Thanks so much. And so our last closing statement will come from you, Vanessa Poster.
Thank you, Rachel. Thank you, Easy Reader. And thank you to all the people who have stayed with us for this hour and 8 minutes to hear about the health district and to learn about all of these great programs that we have. I have spoken often about my 93-year-old father who lives with me and how lucky I feel that I have the space, that I have the capacity to have him in my home to take care of him. He fell last week and he broke 7 ribs. If I needed a place for him to live that was safe and loving and innovative, I would want that place to be nearby so I could see him easily. I want to also encourage people, if you have more questions, I've been having porch conversations on Zoom. You can go to my website, vanessaposter.com, and sign up to spend some time with me as if I'd knocked on your door like I have every other election where I've walked and talked and met with people and talked to them on their actual porches. Please sign up for a Zoom conversation with me on my website. Thank you.
Great. Thanks so much. And on that note, as I mentioned earlier, if we weren't able to get to your questions tonight, I would just encourage you to reach out to all the candidates because I know that they would be happy to engage with you. We are unfortunately out of time for tonight. I just want to thank all of the viewers and readers who submitted thoughtful questions. I just want to thank all the candidates for participating. And so you can tune in tomorrow night to hear from candidates running for a seat on the board of the Water Replenishment District. Thank you all again, and we'll see you tomorrow.
Thanks, Rachel.
Thank you very much, Rachel. Thank you.
Thank you.
Bye.
Bye.